generally said that you should have a bowel movement every day, but everyone has its own normal when it comes to bowel movement. Mostly people defecate between 3 times a day or once every 3 days, and both are considered normal. The digestive system consists of the upper and the lower gastrointestinal tract. The upper gastrointestinal tract starts at the mouth and includes esophagus and stomach, and is responsible for the ingestion and digestion of food. The lower gastrointestinal tract comprises of the small intestine, large intestine, that is colon, rectum and anus, and is responsible for absorption of nutrients, conserving body water and electrolytes, and drying the feces and elimination. The remains of undigested food are swept along the gastrointestinal tract by waves of muscular contractions called peristalsis. These peristaltic waves eventually move the feces from the colon to the rectum and induce the urge to defecate. By the time the stool reaches the rectum, it generally has a solid consistency because most of the water has been absorbed. In those situations where absorption increases, this will generally lead to constipation. So, the infrequent bowel action of twice a week or less that involves straining to pass hard stools, which may be accompanied by a sensation of pain or incomplete evacuation, is considered constipation. Constipation affects all age groups but is more common in the elderly population. So, what causes constipation? Poor diet, that is the diet high in animal fats, for example meats, dairy products, eggs or refined sugar, and low in fiber. Poor bowel habit, ignoring or suppressing the urge to have a bowel movement will contribute to constipation. Laxative abuse, habitual consumption of laxatives can cause constipation as well. Inadequate water intake. Excessive intake of caffeine. Immobility, that is general lack of exercise or prolonged bed rest after an accident or during an illness. Travel, that is change in diet, lifestyle, daily routine. Pregnancy, mechanical pressure of womb on intestine or the hormonal changes during pregnancy can cause constipation. Use of medicines with constipating side effects. Disorders such as diabetic neuropathy, hypothyroidism, spinal cord injury, multiple sclerosis, or Parkinson's disease. General management. Increase fluid intake and at the same time reduce strong or excessive intake of tea or coffee, since these act as a diuretic and they will serve to make constipation worse. Increase fiber intake in the form of fruits, vegetables, cereals, grain foods, whole meal bread. Increased level of exercise should also accompany the raised fiber intake, as this is thought to help relax and contract the abdominal muscles and help food move more efficiently through the gut. Treatment with medication is often indicated in constipation that is associated with illness, pregnancy, surgery, or poor diet. The 4 main groups of drugs used to treat constipation are bulk forming agents, osmotic laxatives, stimulant laxatives, and fecal softeners. Thank you.